Been mandibulectomy on a samoyed that has an epilus up here just between the incisors. If you haven't already done so, please subscribe to our channel and make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So the question here is whether we'll preserve this lip or take a little wedge out. My tendency is to say, just because that's kind of close down there, I think I am going to go ahead and take a wedge of the lip out as well. So I'll do that with a scalpel blade. Mattias tried to hand me the scalpel blade before, but I ignored him. But he was right. Can you just retract them? Just give me some tension on that skin. Kyle, you can, I don't know if you want to come around the front or whatever to get a better view. So we'll come around the other side. Remember that, please, for me. Try to make it symmetrical. There's some counter tension there. So, now I'll cut through the gingiva. Just give me some tension there. Now with an and this is an acanthomatous epilus, or acanthomatous ameloblastoma is the other name for it. And these you have to treat like any other, or like a malignant cancer, or they'll come back. So you have to remove bone on these. And those of you who watch a lot of our videos would know, we might be getting a little light. Would know what the 5 tumors we see in the mouth of dogs are. So the way to remember it is you think of the mnemonic foams at the mouth, and so that's FOAMS, which is fibrosarcoma, osteosarcoma, acanthomatous epilus, melanoma, and squamous cell carcinoma. So foams at the mouth is the mnemonic that you use. The dog's a little bit light, so I'm just going to stop for a minute. So somebody says foam at the mouth, and it's actually foams with an S at the end. So fibrosarcoma, osteosarcoma, acanthomatous ameloblastoma, melanoma, and squamous cell carcinoma. And we have a hello from Connecticut. It is the middle of the night there. What is it, 5 o'clock, 4 o'clock here? 4:20. James, it's 2:21 in the morning. So you need to get a social life. Or just get some more sleep. Oh, God. You're crazy being up at 2 a.m. watching this stuff. It is recorded, you know.
Maybe night shift?
Yeah, it could be night shift, that's true. Apologize. If you're on night shift, then... Let's see if we can come around the other side. I'd like to think that it's really exciting viewing that would be worth staying up till 2 a.m. for, but... Little bleeder there. So we've got a special guest today is Matthias, who's one of our former interns, who's come back to help us out today. Can't seem to get rid of him. Yeah.
A couple more hellos. So hello from the Philippines, New Zealand, Hungary, running 8:30 in Hungary, so there you go. Massachusetts, Egypt, and Portland, Oregon. And then someone did ask, are you going to take 1 centimeter margin for this tumor?
I'm going to take a couple of centimeter margins for this tumor, I think, if I can. Did we get our Mapivacaine already?
I've got it ready. And there's also
Okay.
a hi from Japan.
Hello, Japan. So I've got the mental foramen down here. I'll try to get the nerve block down there.
And then I'm just going to pop some Mapivacaine in person. You just want to take the needle off?
Yeah.
Yep.
And I'm doing well. Good doc, whoever asked. What is your first name, good doc? Thanks for asking.
It is Kenzie.
No, what is good doc's first name?
Oh. Oh, I think a good dog. And I was like, oh, so that's Mapivacaine.
Thank you. So I'm going to try to get the needle down the little mental foramen here. Just to get some pain relief. All right, so we'll get our saw out, cut through here. Let's get another towel clamp. We'll pull that out of the way and get Kyle to maybe go around the other side and just help retract on that. Oh, you got that? Okay. Maybe try to hold on down here. Try not to cut your fingers off. hold off on the saline. Okay, go ahead and take that away. Grab me some mayos, please. Alright, so this is what we've removed there, and you can see that we've got a nice wide margin on the tumor, which is to there, so about 1.5 centimeters.
Miguel from Mexico says, how do you approach the owners about this radical surgery and also thanks as always for streaming?
So I don't, compared to the other stuff I do, I don't think this is that radical, honestly. So this is one that we just show them photos of what it's going to look like, and if they appear to be at all concerned, and explain this. I mean, this dog is very furry as a Samoyed, so it's just going to have a little bit of an underbite, and that's about it. You know what I'm going to do is get a burr, a diamond burr, just to get the roots out.
No worries. What size?
So we'll just get a pneumatic or electric burr, and then like a 4 mil burr.
No worries. Not the actual pneumatic attachment, just the burr.
No, everything.
Oh, everything.
Yep, thank you. So I am going to burr out those tooth roots. I didn't used to do that, but I've had some people tell me that I should. And that in humans that they're quite painful if you leave tooth roots in, so if I can do it easily, I will. And I did block the mental nerve, so I put the needle down the frame, and there you can also block caudally, but I just was having trouble palpating it, and so I did not block that. Let's see if I can get down there better from this angle now. So that's all the way down in there. So that should provide some really good pain relief. All right, so we've got a pneumatic drill here. And I've managed to tie the hose in a knot. The other thing I might need when you're finished getting me that is get me a wire driver and an 062 pin.
Yep. Like a wire collet?
A wire collet for the handpiece, and then an O.
Yep.
Yes, please. Sorry, I need the actual handpiece for the pneumatic. I need the drill, the actual handpiece for the pneumatic.
I know what's on the shelf. Give me a sec. It looks bare.
Thanks. So for local anesthetic, I use mepivacaine down the mental frame and mental nerve. Just waiting on the burr. Because apparently the exposure of that nerve and the pulp in there of the tooth can be quite painful.
So, there's pneumatic reciprocating saw.
So, no, pneumatic driver.
Wire driver?
No,
Pneumatic reciprocating saw.
no,
That's your wire collet. Electric laminectomy.
yeah,
No
no.
cord. Spare electric laminectomy. This is all we have.
So, yeah, let's do the pneumatic driver.
This one?
Yep. See if that's, is it heavy?
Not really.
Open it. We will see.
We will find out.
It sounds clunky.
It's clunky, but it's not heavy.
No, I don't think that's it. Now, that being the case, we will have to either ask Ray or we'll have to get an electric hose and,
Oh no.
yeah,
Let's use the wire collect for now.
yeah. Or the Sumex would be fine.
Okay, I'll have a look.
Yeah, and just go ahead and turn on the core console now because it takes a little while to boot up. So we're just waiting for our burr. Might try to zoom in a little bit so you can see. So you can see those tooth roots right in there. So post-op complications, the big one that you can see is dehiscence, where the whole thing falls off the chin. You know, the whole lip falls off the chin. It doesn't happen often. Usually when it does happen, and then I'm going to need Sumex burrs as well.
Oh, yeah.
Yeah.
Do we have 4 of those?
Probably. Yeah. So yeah, that's the main complication that we see, is the lip pulls off the chin. All right, and then that's all right, and then we'll just plug in our Sumex and we'll be good to go. Okay. Okay. And now we will drill some holes in the bone, and that's going to be to anchor the sutures. All right, can I get some 2.0 PDS, please? Hopefully I can find those holes again. Now let's release the towel clamps so that that can fall in medially, like that. And I find that sometimes I get lazy and don't get out the wire collet to drill my bone tunnels, and I always regret it because that's when you're more likely to have dehiscence. Thank you. Excuse me. Sorry, just release that for a second. Go.
I don't know if you've answered this, but someone's asked about post-op care and complications.
Yep.
Or that.
Yep.
And then someone's asked, do you use peri-operative or post-operative antibiotics in case like this, or both?
So I would use perioperative, so intra-op and at induction and intra-op antibiotics, but not post-op.
Incidence of reoccurrence?
With my surgery, zero, virtually zero. So if you're aggressive enough, they're not going to come back. The only oral tumors that I have recur are fibrosarcomas, and they recur in about 50% of cases. They're very highly invasive. So I almost assume that they're going to come back. But all the other 4, we very rarely have recurrence with surgery. I'm leaving him a little bit of a fake chin. Just because when the fur grows back cosmetically, it's going to fill that in a little bit better. Just closing that little lip margin. Yep. Trying to bury all of my knots.
Someone said, will there be any diet restrictions post-op?
We'll probably do soft food for a couple of weeks and then back to normal.
And there's a hello from Turkey. So.
Oh, nice. So you see, Matt, how I'm doing that kind of inverted, interrupted?
Mm-hmm.
So you're happy to do the rest of those
Yep.
along that margin?
Yep.
Thank you. Make sure that the knots are burying,
Yep.
unlike mine. All right, so I'm going to go ahead and leave you guys. So thanks a lot for watching. It was kind of an interesting case. Haven't done one of these in a little while. I'll be operating again tomorrow, and I've got 5 more tumors tomorrow, and I'll try to live stream some of them. So if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. Talk to you soon.